What's going on, guys? This episode is brought to you by MarekHealth.com, and I want you to go there, use code RBP, and get a blood panel done. Get your blood work done 3 times a year if possible, but more importantly, get it done by professionals who know what they're looking at. Now, I recently went to Marek Health. They did a full panel review. After I was done, I had a half an hour panel with one of their professionals. He fully explained my blood work all the way through and what was right and what was wrong and how to fix it. Furthermore, they were actually able to get me set up with an appointment with one of their doctors and get me prescribed the medication I need prescribed. You know, the benefit to this is big. I've been judged by a lot of doctors. I've had family doctors who've judged me for what I want to do in my life. And being a bodybuilder, it's always hard to talk to a regular doctor about what we do and what our goals are. But at Marek Health, there's no judgment. It's completely objective, and they will help you achieve your goals while staying healthy. Get to Marek Health, use code RBP, save some money, but more importantly, get healthy and get a professional to help you out with what you're doing. What's going on, everybody? Welcome back to the Real Bodybuilding Podcast. This is episode number 159, and I'm here with Dr. Adam Hotchkiss of Marek Health. How are you, sir?
Doing good, man. How you doing?
Good. We recently did a podcast. Well, it wasn't recent. I think it was about a month ago now, where we were talking about a lot of different things that had to do with injections, injection sites, injection protocols. And there were a lot of questions that came up that, you know, we all have our own anecdotal evidence and things that we've done through experience and years, but we didn't have the definite answers for things. So I thought I would ask you to come on to help us kind of shed some light on that topic. And then I also wanted to discuss also some things with blood work and different things guys can do to optimize their blood work and their health. So,
Absolutely.
but before we get into that, tell me a little bit about yourself, your credentials, where you went to school, kind of that, so people kind of can get an idea of who you are.
Yeah, for sure. So yeah, I kind of have a weird background being in this space now with Marek and doing more of the hormone optimization and everything. Because originally in my training, I'm a foot and ankle surgeon, so completely different from what I do, you know, as far as this goes. I kind of got into all of this through a passion of being somebody who has kind of dabbled in self-optimization or maybe degradation through bodybuilding and stuff too for a while, and just a lot of self-experimentation for years. So like when I first got out of high school, I had no plans on being a doctor whatsoever. I kind of just floundered for a while, kind of just screwed around, drinking too much, partying with friends. And eventually one day I kind of got into lifting. That was kind of what really stimulated everything in my career, which is pretty cool because, you know, I started getting way more and more into the sciences. I wanted to know what the bicep curl was doing at a physiologic level and how I could enhance that. So I started diving into the sciences, signed up at a community college, started taking biology courses, physiology and stuff, you know, and just kept excelling from there and there. Eventually working my way into medical school, all based on just starting at fitness, which is pretty awesome.
Yeah.
And then, you know, I kind of dabbled a lot in different fitness modalities starting out. I think like any other guy, I just was doing curls and bench and stuff like that, really getting into like the bodybuilding stuff though. But, you know, I was sheltered at that point. You know, we would question whether like Jay and Ronnie were doing steroids. Like, you know, no one really was talking about it then.
Yeah.
Like,
Yeah.
you think those guys are on steroids? And it'd be kind of a
Yeah.
debate, and it's kind of,
Yeah.
it's kind of funny.
Yeah.
But then from there, kind of got into CrossFit because I kind of got sick of the way of just like basing everything off of a look. I wanted to get a little bit more in performance metrics, and then I did that for years. And then through school, I kind of had to go back to more of the bodybuilding just to, I don't know, facilitate a workout at all. I couldn't be doing 3 training sessions a day like I had to in CrossFit.
Yeah.
So for the past like 5 years, was heavy into bodybuilding until probably hung it up last year. Never got competitive, but definitely got, you know, I looked semi-impressive, was big, did a lot of shit that I probably shouldn't have done. But I just kind of hung it up.
Wait, before you go on, I want to know a couple things. What's semi-impressive? Because people are usually harder on themselves than they should be. What's semi-impressive, and what's some of the shit you shouldn't have done?
Yeah, so I mean, I literally did every anabolic under the sun, and at extremely high doses too. I mean, this is at a point like, I mean, 2000, what, 9, 10, 11, 12, all those years, like all we had was the forums, professional
Yeah.
muscle, whatever. We have GH15 or whatever that dude's name was,
Yeah.
posting crazy stuff like, you need 15 units of GH. We had Boston Boyd saying 3 cc's is what the pros do. And then I'm reading, what are the side effects? And I wasn't in school then. I don't know, it's kind of stupid. Looking, what are the side effects? Hair loss. I'm not losing my hair, so I'm good there. Acne, and I have a few back acnes. That's okay. Like high
Yeah.
blood pressure, it goes away when you get off cycle. Don't worry about it. And
Oh,
so I'm just
geez.
like, shit, there's really no negative side effects here. Like
Yeah.
I look fine. I'm just going to keep loading stuff up. So I did way too much, never got that impressive of a physique too, which is annoying because I don't think I had the genetics for it.
Yeah.
And then when you ask, like, it's semi-impressive, I just simply don't have, the insertions and the body physique to be decent. I think,
Yeah.
I got up to probably like 235 lean, probably like Justin. No, I'm just kidding.
For those,
You haven't made fun of him in a while, so I had to do it. No,
for
I've
the,
never once looked like Justin.
for those
Uh,
people who don't, know, Adam watches the podcast, so that's why he's got the inside jokes.
I
But
do.
so,
No, I was nowhere near him
but you were
whatsoever.
watching. If you were into the forums and GH15 is and all, you were pretty heavily into bodybuilding then at that point.
Yeah, for sure. Yeah,
You know,
absolutely.
it's funny. It it just dawned on me when you said that. It's amazing how, because I remember back, obviously 2008, 9, 10, those times with the forums, there was not a lot of talk about blood work. There was not a lot of talk about what to look for. There was none of everything you just described was the way people thought about it. They were like,
Yeah,
I still got my hair. People took ProScar to keep their hair
yeah.
and oh, I don't have any acne and my gyno's not too bad. So fuck it. I'll just keep rolling. And it's like,
Liver health. I think they would talk about liver health,
yeah,
but then we all take like,
yeah,
cycle support, that scoop, that
yes,
tastes like
yeah,
shit.
yeah, yeah, yeah,
Yeah.
yeah,
And then
yeah.
we'd be like, oh, we're taking milk thistle, we're fine. And it's funny because now knowing like liver's probably like one of the least thing that's affected,
I
it's
know.
crazy.
Well, it's also one of the things that regenerates it, after if you take care of it somewhat, you can get it back to normal.
Yeah, 100%.
And it's funny you say, I cannot believe I forgot that was the way things were.
Yeah.
And just through all of the different YouTube channels and people talking about blood work and how far we've come.
Yeah, it's
Because
amazing.
now I have like beginners. I have like, guys who are just starting out being like, hey, should I go get my blood work done? Like, what should I look for? Like, what markers should I look for? Like,
Right.
and I'm not an expert, but I know a little bit from getting my own blood work done, but nobody would have even ever asked that at any level.
No, because
10
like
or
we said, nobody was even really talking about doing it. Like you had
yeah,
to get into those forums to kind of unveil what was going on in the real world. But it's kind of a double-edged sword, I think, with the popularity now. Because on one end, we do have a lot more education, so people can do things potentially safer. But we also have like every dude who picks up an iPhone and takes a picture in a gym, like, to be an influencer, they're running something at a young age. And it's like
yeah.
crazy. Like, before it was literally like, we would go get cell tech and we would, you'd invite your friends over to sample the new pre-workout and fun. And they're probably doing that with gear now, it's crazy because everybody's doing that. And it's, so like you said, it's a double-edged sword.
Well, I think there's more people doing gear, but just because there's more people involved in fitness, period. I mean, if you
True.
think about it, if you think about, the early 2000s, it hadn't exploded the way it had to date because there wasn't classic, there wasn't really men's physique had just been starting. So
Right.
I think it's become a lot more mainstream in the last 10 years. So that's why the steroids have become so much more prevalent as well.
For sure.
But I would say that if we're going to pat on ourselves on the back as a whole, like as an industry, I think it's good that along with the steroid increase has increased the awareness to get your blood work done. Because like I said, like everything you said was true. Nobody cared.
Yeah. Yeah, no
Yeah.
one knew, we
So
thought they were safe. Remember the bigger, stronger, faster, whatever the guy said, like, show me the bodies, and I was
yeah,
like, yeah, that's true. And now we're freaking stepping over them left and right, unfortunately,
yeah. I do want to go back for a second though, because you said you were partying and then end up being a doctor. And I'm
Yeah.
like, it's like you don't generally hear somebody end up being a doctor unless they kind of know they're going in that path. So
Yeah.
how do you go from like I didn't know what I wanted to do and then I decided I want to be a doctor? Like, how do you just make that kind of switch?
It was a long transition, but I honestly feel like fitness that really made me that person, because I just dicked around all through high school. I was like a skateboarder. I was in that crowd of really just like a punk rock, long hair, skinny jeans skateboarder kid. Then partied a lot. And like I said, kind of found fitness where I was like, I need to do something with my life, got a gym membership and started working out and started just learning, I don't know, those traits that like bodybuilding, CrossFit, powerlifting, all, that teaches you that discipline and, just like buckling down, doing something. And so I don't know, like I said, I kept progressing from there. Like first I was a personal trainer, and then I thought, I want to do more than this. Like maybe I can be a nurse or something. And then I did a few more courses. Like maybe I can do more than a nurse. I could be a PA. And then I started shadowing a doctor, and he was like, you have the capability to be more. Why don't you just shoot for the stars? And
Yeah.
I didn't even think that was possible. I came from like a kind of lower class, or I don't know, middle class, I guess. But I thought that you would have to, grow up with like parents who went to Yale and be on yachts and everything
Yeah.
to become a doctor. I didn't really realize that hard work could get you there.
Yeah.
When I learned that, I was like, shit, I can outwork anyone. I might not be smart, I might not have this pedigree, but I can buckle down and do the work. And that's what I think bodybuilding fitness taught me, is like, if you put in the work, you do get results. And I kind of just kept achieving my way.
That's a really fucking awesome story. So I just want to get a sense of a timeline here. So partying when? Age 20? And then
like probably too early, like all through high school, like 14, 15, 16, then up until like 21, I think is when I started my first community college course.
So then how long did it take you from the time you started and to buckle down to actually becoming a doctor?
So that was almost 5 years of undergrad, and then 4 years of school, and then 3 years of residency after that.
But you must be somewhat of an academic if you can, because I don't, look, I'm fascinated by the body, but I'm not an academic. I'm not going to sit through 7 years of schooling like that. You must be somewhat,
Yeah, I think like I learned from my dad, who's basically like, if he had a problem, it was like he would go get a book or a few books and read all of them. He built our deck and stuff. Like he would just do things like that. Like we need a new deck. He doesn't hire somebody. He goes to the library and gets books and reads them. And I just kind of learned that like he buckles down and learns new things. I felt like I couldn't. I'm always super inquisitive. I never ask a question and just put it out into the, like, I wonder if this, I say, I wonder if this, and then I go look it up like immediately.
Okay.
And I'm scouring. Yeah. I've always kind of been that way.
Yeah.
So it's my curiosity more than anything. I don't think I'm inherently super intelligent by any means. I just have curiosity and work ethic.
Yeah.
So and I think that those two traits get you further than inherent, skill.
So why foot? So when you actually became a doctor, what's the first thing you became a doctor? Is that foot and ankle? Is that where you first went to?
Yeah, so I went into podiatry, which is when I was in like undergrad and I was shadowing, I worked for a dermatologist. That's the guy who kind of promoted me. So it was skin. And then I started shadowing a lot of orthopedic surgeons, and I really like the bone surgery. Both of those two specialties are super hard to get into when you're in medical school. You have to apply for residency. And so I knew both those are super hard to get into. That sucks. And I knew that. And then I met a podiatrist, foot and ankle surgeon, and he came into our derm clinic to help our dermatologist with a nail procedure. And I was like, kind of talking to him about what he does. And he was helping us with dermatology. He just got done fixing an ankle fracture. And I was like, oh, those are my two favorite things put into one. Mm-hmm. And so, yeah, I just, at that point, I'm like, okay, I know I can go down this road and do two things I'm super passionate about. Had I known my life would take such a different course here with like Marek and stuff, I probably would have specialized more in what I'm doing now.
Yeah.
But I have the experience of life that, most docs don't. Like, I tell people when you're coming to Marek, like, I'm not be able to prescribe you tren, but at least I know what it is. And I can talk to you about how to do it safer and what, And so I think that even though I don't have the background in like endocrinology, I would say I can go toe to toe with most endocrinologists on hormone stuff and probably even be superior to them. I'm not trying to be cocky here, but a lot of them just don't learn stuff like performance enhancing, human optimization. Even TRT is still like a really something that most docs don't even know about.
So just so people know, full disclosure, Adam is my doctor at Marek, and that's the reason I asked him to come on the show, because we were going over, I think I had something like 47 vials of blood taken, and they did like 100 different lab markers, and Adam sat there for half an hour going through each one of them with me and how I could make them better. And hearing the knowledge he had, I was like, okay, maybe this would make a good podcast, but not just because. So I've had other doctors that understand blood work, and I've had other people on the show that understand blood work. Dan Garner, for example, is a lab analyst. Like, he understands it very thoroughly.
He's excellent.
But when you told me that you've kind of been down this road and you've done the bodybuilding thing and you've done all the steroids and you've done all the, to me, it's kind of like when I work with John Meadows, it's kind of like somebody who knows the science, but has actually experienced it as well.
Absolutely.
So I felt like that was valuable then for us to have a discussion, a further discussion publicly on the podcast, to kind of go through some of the things that people are having trouble with or don't understand, or things that can help make their bodybuilding careers better or more health, or mitigate some of the risks.
For sure.
So no, I definitely think the experience you have plays a huge role. Now, just before we get into some of the specifics, I want to ask you about, how do you get into Marek Health? I mean, obviously it's because you have a bodybuilding passion, but how do you get into that? And are you still interested in being a foot and ankle doctor if you're like, if this is really kind of what your passion is fitness and the bodybuilding world?
Yeah, I think I like pretty soon on, I'm like, shoot, I really don't have much of a passion for this. And it was mainly because it's the exact antithesis of what we do at Marek and what I'm about. Because, I kind of got into health and fitness, or I got into medicine because health and fitness, like I said, that was the impetus that kind of progressed. And then when I got into medicine, especially in foot and ankle, we're dealing with mainly diabetic population. And so these are people who I would see as a pre-diabetic and give them a warning, kind of give them a foot exam. And then I'd see them a year later and they'd actually have diabetes at this point. And then I'd be really give them another talking to. I'd see them another year and I'm taking off a toe because they have an ulceration. A few months go by after that, I'm taking off half the foot. A few months after that, we're taking off the whole leg. And I'm like, this is exactly like the opposite of what I wanted to be doing. I wanted to promote health and fitness and wellness. And, as a podiatrist, yes, I can work with athletes. The ankle fracture does come in, the sprain, that happens. But 98% of our stuff is just like diabetic foot care, because these people have ulcerations in their lower extremity, and we're dealing with doing limb salvage. And so I got pretty burned out on that pretty quickly. And then just one day randomly, it's kind of weird. My wife says that I manifested this and I don't believe in that shit. But I remember seeing Marek and I was like, that's a cool company. I just remember thinking to myself, like, it'd be so cool to work for them. And then I wake up one morning to Derek in my DMs. Yeah. I'm like, this must be fake. I know this dude. He's like that YouTuber. Like, it's probably some ad. And it's a voice message from him like, hey, dude, I'm starting this company. Like, we would love to bring you on. And I'm like, the fuck, like, how did this happen? I guess they saw my picture on Instagram or something, or looking for docs that kind of fit my phenotype and brought me on.
That's fucking crazy, man.
Yeah, it was weird.
But I gotta go back for 1 second just because I'm super curious. So what's it like? This is gonna sound like a stupid question, but I have to ask it. What's it like cutting off someone's toe or someone's foot or someone? Is it something, let's say the first time you did it, is it crazy?
Like, crazy. I remember the first time I was like, telling my classmates, like when I got to shadow or be involved in surgery, it was like a lot harder than I thought. Like cutting a toe off, you watch on the movies, they just clamp it right off.
Yeah.
So many soft tissue attachments and everything. Like, I can get it done in probably like 10 minutes, like where first incision to suturing, I can do it fast now, but it's definitely a process and it's kind of gnarly.
So when you see it done in the movies, it's total bullshit. Like, you're not just,
I mean, theoretically, they could do it that way because you're not trying to suture it up and everything, right? So it's just going to be an open, like, circle. We need to do more of an ellipse and stuff, but it's not bullshit. It's just like there is a lot of like soft tissue that you wouldn't expect. Like, it would probably take you longer than just that snip that they do.
Okay, on a more sorry, it's the bro in me coming out. Okay, so on a more serious note, though, what's it? When someone comes in with something like that, what's it like having to tell them, I got to take your foot off, or I got to take your leg off? Or, I mean, how far up the leg have you gone?
Yeah. So you can either do below knee amputation or above knee amputation. Below knee is preferred because you save a joint.
Yeah.
But yeah, I mean, it's hard. You kind of get jaded after a while, because we just deal with it every single day. And that's what I hated too, is just like, this is becoming commonplace. Yeah. When you're in a podiatry practice, all you're seeing basically is, limbs being chopped off every single day.
But when you're telling people, like, was it hard for you to tell somebody the first time, like, hey, is that what you do, or somebody do that for you and then you just do the work?
Yeah, no, I'll do it. And yeah, it can be hard. Like I said, you kind of at the beginning, it's hard. You got to have that conversation. Sometimes it's still hard. You feel bad for these people, you know.
Yeah.
But it's interesting. What's really interesting with like diabetes is a lot of them just don't care. I've literally had people tell me like, I prefer food more than my feet. Take them off; they're not doing anything for me. You know, I've literally had a patient straight up say that. It was kind of funny. He thought it was funny, but I'm like, I think that's how these people feel because they don't change their lifestyle. You know, diabetes is something that's 100% reversible, and
But
it doesn't need to lead to that.
is the addiction to food, because I do believe that you can be addicted to sugar, obviously. I mean, I don't know if anybody else believes that, but I believe that. So is the addiction to food so great that they're just like they've justified it to themselves that it's okay?
Yeah, I think so. It's just, that's their whole lifestyle. They're stuck in that way, just like any other addiction. It's
Yeah.
multifactorial, and there's usually a socioeconomic factor to that, and a cultural factor, and so many other things in that are involved. So, I mean, it's easy for me to judge, from my pedestal and be like,
Yeah.
why don't you just, clean up your act? But I know there's a lot more going on there. Unfortunately, it's just hard to deal with as a practitioner because you do almost get jaded, and I'm like, I shouldn't be this jaded at a young age on cutting someone's foot off. It's just like,
Yeah.
routine stuff at this point,
Yeah.
which kind of sucked.
So
Where
when
I,
you
oh, go
sorry
ahead.
sorry to interrupt you. When you see these patients, obviously you see them before you have to cut their feet out. You've seen them all along.
Mm-hmm.
So you're telling me that somebody will come in, they're pre-diabetic, then they're diabetic, and all along you're telling them, hey, this is where it's heading. And they just don't, no changes are made.
Yeah, happens a lot. I mean, that's when I started seeing that in my residency, and like my best friend in med school and I were super into fitness, and we went on to two different residencies. We would just kind of be texting each other at night, like, "Man, this sucks." This is like
Yeah.
the exact opposite of what we wanted to be doing. Yeah, and so it's actually interesting though. I got involved in like TRT space through the foot stuff
Mm-hmm.
because like when I went out into practice, I had a patient who had this recurring ulceration, and I just couldn't get it to heal. So I was trying everything, and I kind of started scouring the web for looking for new kind of modalities. And there was a paper out of Russia where they looked at using TRT or testosterone replacement therapy for healing diabetic foot ulcerations, because most patients with diabetes usually have hypogonadism or low testosterone levels.
Yeah.
And they were able to heal this wound through the application of testosterone alone,
Wow.
like TRT.
Yeah.
And so I'm like, awesome. I called up this guy's primary care, showed him the study. I'm like, can we start this? And he was like, I don't have a lot of experience with testosterone, but it sounds like you do. Like, I'll help you to facilitate this. And so between his primary care and I, we got this guy on TRT, got his wound healed within like 4 months, I think. And that's when I started looking more into hormones too, as they relate to the foot and ankle, which was pretty cool.
Yeah. Yeah. I would have never guessed that low testosterone contributes to diabetes.
It's usually the other way around, but it can be that way too.
Oh, so
So
diabetes contributes to low testosterone. Okay.
yeah, I mean they kind of snowball off each other after that, but usually
Yeah.
it's the elevated insulin kind of interfering with the hypothalamus and the pituitary, the signaling to the testes, and then the high insulin and sugar can affect the testes production too, and then it just goes back and forth.
So let me ask you this then. If diabetes contributes to low testosterone, if you're somebody who says, okay, I have type 2 diabetes and I want to get my shit straight. So let's say I go on a keto diet or something, or I do some intense training and bring my my diabetes back into range, or my A1C back into range. Does that help your testosterone, or doesn't do anything for your testosterone? It won't raise it, will it?
It can, yeah. I
Okay.
mean, it depends on how far gone your testosterone production is, but that's one thing I'm usually trying to harp on guys a lot too, because we get nowadays everybody wants TRT. Like
Yeah.
it's on every single post somebody's talking about TRT,
Yeah.
and so we get a 23-year-old guy in kind of overweight, insulin resistance, has sky high fasting insulin, his A1C is in pre-diabetic range. I'm gonna try and talk to these guys like, if you just fix this stuff, your testosterone will probably autocorrect. And instead of having to inject yourself, 3 times a week for the next 50 years, why don't we just focus on some lifestyle stuff right now and
Yeah.
optimize your natural production?
Yeah.
Because it can be done. So that's what I'm, if I, as a practitioner myself and as a coach and everything through this, I try to optimize all the lifestyle stuff first. Like, let's check off every single box that we can outside of pharmacology first. And if need be, then we can transition to TRT. That should probably be the last thing. And unfortunately, most people now put it as the first thing,
Yeah.
and that's the Band-Aid.
Well,
Really,
it's easier to take a shot than it is to change your entire lifestyle.
Exactly. And then it
Right.
makes you feel good. And I can't tell you how many times people tell me it feels good. And I'm like, heroin feels good too, like, because I get people on cycles, like, I feel great. And I'm like, yeah, I know
Of
that feeling.
course.
I've been
Yeah.
there,
Yeah.
but it's not a good thing. Like I said, heroin, cocaine, all these things make you feel great. We shouldn't
Yeah.
just be how you feel.
Yeah. 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 So, okay. So now that we're kind of into the diabetes discussion, let's go a little bit further just so people can get some information. So can you, I said A1C, but I didn't describe what it was. Can you describe to people what your A1C is?
Yeah, it stands for hemoglobin A1C or HA1C. So that is basically your red blood cells are in circulation. You also have glucose in circulation. When we look at your red blood cells under a microscope, when you get your blood drawn, they're looking to see how much of a deposit that sugar is basically made on the glucose. It's called glycosylation. Did you ever make like those rock candy things as a kid, like the sugar on a string? The
Yeah.
sugar,
Yeah. Yeah. Yeah.
yeah, kind of crystallizes. Well, essentially, it's doing that to our red blood cells too, so they can kind of look and see how much sugar your red blood cell has been exposed to over the past 90 days of its life. And so we know that if it's above a certain percentage, like above 5.7% glucose, then we know that you are in that pre-diabetic range, that your glucose has been very elevated over the past 90 days.
So it's a measurement of your sugar, your glucose in your body over 90 days.
Correct. Yeah.
Okay.
So instead of like a fasting glucose, which is just
Yeah.
at that minute, which so many things can interfere
Yeah.
with, we can look at A1C and get a better reading.
And to my knowledge, A1C has always been the way any doctor I've seen has measured whether I'm pre-diabetic or whatever. Like
Yeah.
that's the measurement, right? That most doctors or all doctors go by.
Yeah. You can definitely do that. And then you can do like an oral glucose tolerance test too, where we, give you glucose and monitor your glucose for the next few hours to see if you're able to clear that.
Mm-hmm.
But the A1C is easy. You can just order that and see like your sugar's been super high on average for 90 days.
And you said 5.9 and below, like 5.5 to 5.9. Is that pre-diabetic?
Yeah, it's usually after 5.7.
Okay. And
And
then
then,
is it over 6 is considered type 2
yeah, I
diabetic
think
or
like 6.2 maybe.
okay.
Don't
Okay.
quote me on. I
Okay.
think it's 6.2.
Okay.
At Merrick, it's kind of funny because I do almost Merrick now, and our ranges are so aggressive. We're trying to get somebody from like a 5.4 to a 5.1, and then
Yeah.
at my in podiatry, I'm dealing with people who have like 9, like just standard. So, but like I forget what even like what normal is, because at Merrick we're so into optimizing. Like, let's turn
Yeah.
you into a superhuman. So yeah, we're aiming for like a 5.0, 5.1, 5.2.
Yeah. Well, just so people know that there is ranges. Like I've seen doctors who've told me like 6 is pre-diabetic, 6.5 is diabetic.
Yeah.
I've also had doctors say 5.5 is pre-diabetic, 6 is diabetic. So
It always changes
yeah,
based on what lab, what hospital,
yeah.
what body you're working under.
Okay, so now we've established that. So somebody goes to get their blood work done. Let's say they're at 6. What are some of the, well, before we get into some of the lifestyle changes they can make, is there medications they can take? I know people talk about metformin and things like that. Is there things that they can take that will help bring that blood sugar down?
Yeah, absolutely. Metformin's great. I know Paul's a huge fan of metformin, right?
Paul,
That's
Paul,
like
Paul eats a pizza, takes a metformin, and he's golden.
that's
He's
hilarious. I kind of do the same at this point. I know the science is like not there, but I'm like
yeah.
bro science. If I go out all you can eat sushi, I'll have 500 or 1,000 milligrams of metformin, and I swear it helps.
Okay, not to be gross, but before you explain about metformin, I got to tell you. So I tried taking metformin like I don't know a few years ago, and I know this is a common side effect. That's why I'm bringing it up. It gave me extremely bad gas, like to the point
Oh,
where
just
like
gas?
yeah, it's all I didn't. I don't know why. Is there something else I should have gotten
Yeah,
from it?
diarrhea, man. The
Oh,
diarrhea is bad.
I didn't get diarrhea. I got really bad gas to the point where it was uncontrollable. Didn't smell. It just wouldn't stop. And I'm like, I can't take this shit anymore.
Yeah,
So how do people get through that? Because I know that's a common side effect.
it usually goes away. So we kind of hypothesize it's probably almost like remodeling the gut microbiome and probably helping it. So the
Okay.
more gastric effects you have, probably the more deranged your
Okay.
microbiome is, and so it's kind of fixing it. I've had
Okay.
something super similar, but with berberine. Have you ever taken that?
I've taken berberine, yeah, but I don't get the effect with berberine.
And berberine messed me up. So,
Really?
like, I did my residency in Phoenix and then moved out to Michigan. And it was like 2 days before taking the drive, and I got berberine and I started supplementing with that. And I don't know why I didn't put two and two together, but I ate a big meal, took berberine, and then that night I was up all night vomiting, like violent vomiting
Oh,
and diarrhea. So I thought I got the flu, or like food poisoning.
yeah.
And then we're driving out to Michigan. We decided to take like 2 weeks to stop at various hotels and things. And again, we pull out the sups and I take my berberine that night, insane vomiting and diarrhea. And I'm like, oh shit, like something's wrong with me. I think, I'm getting really bad. That cleared up. And I did it a third time. The third time was the most embarrassing because I was like bulking and bodybuilding during that time. I ate what I ate. I ate like macaroni and cheese with tuna, like 3 cans of tuna and like white sauce mac and cheese just to get the calories in. And then I went to get a massage at like a massage envy, took the
No.
berberine because of all the carbs I took. And I'm sitting there like with the worst bubble guts. I started dripping sweat because I was like, I'm going to shit like all over this lady and I'm going to throw up through this hole. Like she finally finished. I was like, it was the most agonizing like hour of my life because I was just like holding back.
Holding it.
I sprinted into the bathroom and just unleashed all over their walls. Like it was so embarrassing. I spent like an hour in there cleaning up afterwards. And I finally realized, like, you know what? Every time this has happened with berberine, and I threw it away,
Yeah.
it's never happened again. But so I have
Somehow this podcast always goes to that area.
that
Anyway,
one that was terrible. That was the worst experience of my life for sure. I
so
did not enjoy that.
so you're saying so if people are taking metformin, you're saying uh if they just if they just deal with it for a couple weeks, it should clear up and they should be normal
Usually.
after. Okay.
Yeah,
So
usually. And metformin works to kind of help. I mean, bodybuilders kind of call it a glucose disposal agent,
yeah.
and it kind of does work that way. So it increases GLUT4 receptors, which are glucose receptors on muscle cells or various cells, and it allows more glucose to come in.
Mm-hmm.
Um, those can get kind of messed up when you're insulin resistant. So you don't express those receptors as well. So the glucose stays high in the blood. It
Okay.
also stops your liver from overproducing glucose. So when we become insulin resistant, one of the things that happens is our liver starts overproducing glucose and just adds to the problem. And so
Okay.
metformin will stop that overproduction. So it's kind of working twofold. I've always almost looked at it as a performance enhancing tool, though,
Yeah.
with that glucose disposal. In the forums, I don't know if you've seen, but people will talk about its potential to like possibly reduce hypertrophy, reduce
Yeah. I've
IGF-1.
never seen that.
Yeah, there's a study out there that they'll always cite, and I don't think it's applicable because they basically gave it to, I think it was men 65 years old and above. I think they were taking in like 50 grams of protein a day. They were untrained. And so they had them work out and they didn't gain any mass. And so everybody's like,
Yeah.
see, it limits protein synthesis. And I'm like, that's not us, that's
Yeah.
not people who are on gear, who are taking in their body weight in protein, who are young, who are training, so I just don't
Yeah.
see that it translates. I think they were also taking like 1,700 milligrams. We usually recommend like 500 for a bodybuilder.
Okay. Okay. So what other drugs can you take? I want to get into insulin resistance afterwards, but what other drugs can you take to try and help lower your A1C?
Yeah, the new, I mean, there's a huge
Or supplements or drugs, sorry.
yeah, berberine works very similar to metformin, like we just talked about. And unfortunately, I can't do that.
Yeah. Yeah.
But yeah, berberine's great. There's even things like chromium, cinnamon. I think really though, just exercising, dropping the calories down
Yeah.
is the most effective. Of course,
Yeah.
in bodybuilding, you do get to that point when you have to be in a caloric surplus, and that's maybe when you can throw in like the metformin. Even, I think it's actually probably healthy for a lot of guys to do some basal, like long acting insulin, which I wouldn't recommend outside of the scope of your doc, but it probably is going to take some burden off your pancreas and kind of help you to get some of that, that glucose into the muscles that way. So
Okay.
there's a lot of different modalities.
I've heard that before, but I've heard conflicting things about that. I've heard your body is made to be able to produce it anyways. You don't need to help it. But then I've also heard, which sounds logical, is if you take a little bit of long-acting insulin or you can actually help your body. But then you will also have to be on a very specific diet, don't you? Because if you're taking like a Lantus or something that's a long-acting insulin and you're eating like a high-fat diet, or not a high-fat diet, but even moderate fat, aren't you going to just gain weight, like bad weight?
Not necessarily unless you're in like a caloric surplus. And,
Yeah.
I would say I think where bodybuilders got it wrong with insulin over the past few decades is they always ate the carbohydrates to match the insulin and not
Yeah.
the other way around. Like I'm sure you would be like, I took X units, I need to eat this many carbs.
Yeah.
Like I don't know why it never dawned on somebody like, why don't we just use the insulin to match the food that we're already taking? So you would
Well,
have
no.
a plan.
Well, no, I don't think it was that. Well, for me anyway, for the people in my circle, people I spoke to, it wasn't that, oh, I want to take 20 IUs of insulin, so I got to eat 200 grams of carbs. It was more, I want to be able to eat 100 grams of carb. I should eat 50,
Yeah.
but if I eat 100, I'll get bigger. So let
Right.
me take, so let me take 10 IUs of insulin so I can get that 100 grams of carbs in.
Perfect. That's smart. I feel like that's a smarter way of doing things for sure.
But
Where
that
I
was,
feel like,
yeah. So it's kind of like the way we thought of it. And like I said, I don't know if this is scientific or not, but the way we thought of it was normally my body can process 50 grams of carbs pretty easily. If I take the insulin, I can probably process 100 grams of carbs. So that's kind of how we figured it.
yeah,
So,
that's smarter for sure.
but I feel like even if you're doing that, the theory was, and I don't know if it was always, you have to stay on a low fat diet because that insulin is going to store more fat if you're
Yeah,
taking 300.
I think that's right. I mean, for the most part, I think mm, you're probably better off staying on a kind of lower fat diet and a caloric surplus anyways, in my opinion, especially when you've got, obviously we're skewing things with performance enhancing drugs, but like I always tell people, de novo lipogenesis, which is the creation of fat out of a non-fat material. So like turning carbs into fat, it's
Yeah.
actually pretty hard to do. Turning
Okay.
fat into fat, super easy.
Really?
So yeah, I mean, if you think about turning fat into fat, like your body doesn't really need to do anything to take that fat you took in and store it as fat.
No, but I always, that makes total sense. But the way I think people always think of it, or people that anyway I've spoken to, is if you are taking in more carbs than you need, there's that extra carbohydrate intake is going to turn to fat. But they always made it sound easy, like it's like if you just, you know what I mean,
Yeah.
it's just gonna happen like that. So you're saying it's not that easy.
And yeah, it's a complex biochemical process, and that's like people who like, Lane Norton have tried to kind of debunk those because people don't understand the biochemistry and
Yeah,
it's so complex and there's so many moving parts. Essentially, you overconsume anything and you can store things as fat,
yeah.
but the actual storing of the actual conversion of ingested carbohydrate into fat is actually a pretty hard process. It doesn't occur very often.
So it's not.
Usually,
So sorry. So it's not necessarily that people are taking in too many carbs. It's just that people are taking in too much food. Period.
absolutely. Yeah, 100%.
Okay. So if my okay, that makes sense. So um, so you're saying, so if we go to lifestyle changes for the A1C, I know we're going way into far into insulin, but this is just interesting to me, and I think it's funny because I think a lot of bodybuilders, especially ones that have been on long bulking off seasons for a number of years, usually deal with insulin sensitivity.
Yeah.
If you're taking GH, you probably deal with higher A1Cs and things like that. So that's kind of why I want to delve into it. Now, if you are that guy and you're bulking and you're taking GH and your A1C is like pre-diabetic, say, what are some lifestyle things you can do that won't affect your career path, but can bring down your A1C at the same time?
Yeah, lifestyle is hard for the bodybuilder. For your average person, I would say stop eating as much, move more, whether that be resistance training or cardiovascular. And bodybuilders are probably already doing both of those things. They could maybe implement a little bit more cardio, which I think bodybuilders have well known for years, and they do that to maintain some insulin sensitivity.
I don't think so. I think it's becoming more
Right.
knowledgeable now, but I think a lot of guys are still like, I don't need to do cardio in the off season.
Yeah.
So
Yeah.
I think that is something we should probably like drive home. Like, so if you're on a bulking cycle, you're taking anabolics, you're taking GH, you have insulin resistance or your A1C is a little bit high. If I added in like 30 or 40 minutes of cardio, like hard cardio, like I know the high intensity cardio does more obviously. So if I added in some hard cardio, 4 or 5 times a week, is it going to help bring it down if I'm still eating a lot of food?
I think so. It's always going to be hard. You're going to be fighting an uphill battle just based on the increased intake that you have and the GH. But it's definitely a tool, and
Okay.
it's all about adding as many tools as you can, And so you'll have like a metformin, maybe a berberine, maybe some other supplements, cardio, doing everything that you can for sure.
Okay. Would you recommend take that same guy or girl, would you recommend, let's say, like a 4 week cut, like where, or a 4 week where they go on, like maybe they take the GH out, maybe they lower their calories a bit and help bring their A1C back into range? Would 4 weeks do that, or is that not enough time?
Possibly. Yeah, I know
Yeah.
there's actually I just, brought up Lane doesn't I think he does that kind of thing where he does those mini cuts with his
Yeah.
clients and himself, but it's
Yeah.
always hard because he's more of like a natural and coaches a lot more natural people.
Sure.
It's hard to say, but it sounds like it would probably have some utility.
Yeah. So when people talk about insulin resistance, what exactly are they talking about? Because that term has been thrown around quite a bit. And I think a lot of people say it even though they don't know necessarily what
Right.
it means. So maybe you can explain a little bit about that.
Yeah, so insulin is a hormone made by our pancreas in response to eating, and it helps to shuttle in that glucose into the cells. So, like we talked about, the glucose needs to go from the blood and get shuttled into, say, the muscle, for example. Insulin is that hormone that tells the muscle, the glucose is here, let it in, kind of helps us shuttle it in. What happens is if we get to a point where we're eating too much or whatever other reasons have caused the insulin resistance, that insulin isn't really having a signal on the cell. So, it's knocking, but no one's answering. The cell stays closed off and the glucose remains in circulation. So we just start producing more and more and more insulin, but the insulin isn't doing the job. It's not helping to shuttle it. And then insulin in and of itself has a lot of detrimental deleterious effects on our health. It's inflammatory. It's kind of implicated in pretty much every disease state, from atherosclerosis, cardiovascular disease, to obviously diabetes, but cancers even have root in insulin resistance.
Mm-hmm.
So insulin's definitely a bad player when you have too much of it and when your tissues become resistant to it.
Well, this is one of the things John used to tell me too. And if you can touch on this a bit, is John used to tell me to always, one of the most important markers he wanted me to check was my fasted insulin.
Absolutely.
So what exactly that just means, like when you wake up in the morning, the amount of insulin in your blood already, having not eaten anything.
Exactly. So if you take what I just said, where its job is to help to deal with food after you've taken it in, theoretically, there really shouldn't be much insulin at all in your system if there doesn't need to be. If you're insulin resistant, though, things are kind of skewed and your body's inappropriately producing too much insulin. It's high in circulation. And we can kind of tell, like, you're overproducing insulin. You have way too much in a fasted state. And so it's kind of a rudimentary way to see that you probably have some early insulin resistance.
So you said something about lowering calories overall to bring that insulin resistance back to normal, or to bring your A1C down. But wouldn't it stand to reason that you should bring your carbs down, because aren't carbs really triggering the insulin response more so?
Well, if you look at like studies of you can take in pure whey shake and nothing else, and insulin spike. So
Yeah.
insulin isn't just carbohydrate
No,
driven.
no, I understand that. Like I know anytime you eat anything, your insulin is going to spike, but is it false to say that your insulin would spike more if you ate carbs or simple sugar or anything? No.
No, you'd definitely be right. And so yeah,
Okay.
I think that I just try to kind of make it as simple as possible. Like the reduction in overall calories is really what matters.
Okay.
Because you can see, like, the Twinkie diet that's loaded full of sugar. That dude, all of his lab markers improved by eating nothing but Twinkies in a caloric deficit. And
Yes.
so we know that it's the caloric deficit that's really the best. I mean, if you want to structure your diet to at like while bulking, obviously having more complex carbohydrates, et cetera, and not just cramming sugar all day is probably going to get you further in a
Yeah.
caloric surplus than eating crap.
Sure. Okay. The one last thing about this I want to touch on was you mentioned long acting insulin. So let's say you're in that high insulin, in a fasted state, and you have insulin resistance, and you have your A1C is kind of borderline, but you want to keep on bodybuilding. Like, I want to keep going. Like, I'm making really good progress. I can't do a mini cut. I can't stop eating. Is this where something like a Lantus or a long acting insulin, would that help me, or is it just going to compound the problem, or is it a band-aid?
Yeah, you're right. It's I've never actually thought about it until now, but you're right. I mean, if you have just insulin resistance, so you have that high fasting insulin, just adding insulin alone to the equation, you've already got high levels of insulin. What's that really doing?
Yeah.
The idea there is to more take the work off of the pancreas and the beta cells producing the insulin, but I don't think it should be used in isolation without something like a metformin if insulin resistance is the actual issue, because you need something to sensitize the cells to the insulin and not just an abundance of insulin.
Okay. The reason I asked that is because I think and I don't know for sure if obviously not everybody thinks this way, but this is what I've heard in the industry. I've heard from people that like, well, if you have insulin resistance, if you take some insulin, it will help shuttle nutrients back into the muscle and it'll help your body like process your carbs better. But now what you're saying makes sense is you can take the insulin, but if you don't have the metformin or something to sensitize the cell, then it's pointless.
Yeah, I mean, if all your issue is insulin sensitivity, or insulin resistance rather, you're resistant to insulin. So you need to have something that helps you with that sensitivity part of the equation as well.
Now, if you have that much insulin floating around in your blood, do you even need to take extra insulin? Like, shouldn't you just take the metformin and get that?
Yeah, I think there's an argument to be had there for sure. Yeah. Like I said, the idea for like something like Lantus more came from the idea that let's take some, like give the pancreas a break that's having to nonstop excrete this insulin every 2 hours that these guys are taking in, 100 carbohydrate meal or whatever. You can take some of the burden off of the pancreas, because one of the parts of diabetes that happens is not only the insulin resistance, but also the beta cells in the pancreas essentially burn out. Mm-hmm. And so you get to a point where not only do your cells not respond to insulin, but now you're not even making insulin, and you just have this net overall extremely high glucose level. And so usually type 2 diabetics need to take an insulin because their pancreas doesn't make it anymore. They're now insulin dependent. And they also need to take some type of like a metformin to sensitize the tissues.
So really the only time somebody should be adding in something like a Lantus or any insulin really is somebody who's not insulin resistant.
I would say that's
because like
a good assumption.
So these bodybuilders have been just pounding away at this shit, thinking it's helping, and they're actually just making the problem worse.
Potentially, yeah.
Okay, so you guys all heard that. If you're going to take insulin, the most optimal time would be if you're already insulin sensitive, not resistant.
Yeah, and you can't know that too without really in-depth lab work and having somebody who knows what they're interpreting, read it, and even just the fasting insulin alone, that isn't the best marker. Like you may need to do like an oral glucose tolerance test, you need to look at your A1C, you need to look at so many different things. A lot of people will just look at their fasting glucose and they're like, it's fine, I'm not diabetic, or their A1C, and move on.
It's funny you said that, because I think nowadays when I hear it, I think a lot of people don't even get their blood work done. They're like, I put on some weight, I think I'm insulin resistant. Like they don't actually like get their blood work done to find out. They're just like, well, I got fat, I must be insulin resistant.
Yeah, it's a catchy term, and that sells a lot too. Like if you say you're insulin resistant, they buy your supplements,
Well, no, I think it's like I've seen guys, because I used to coach. So, I would give people a certain amount of carbs a day. They'd be like, well, I'm insulin resistant, I can't eat carbs because I'll get fat. And I'm like, you don't know that. Like, you know what I mean? So, okay. So major point of reference, get your blood work done if you want to find these things out. Don't just guess based on your body and what it looks like.
For sure.
Okay. Let's move on from diabetes. I wanted to ask you about injection protocols, because we had a big debate about it, and not a debate. We were just tossing around some ideas and we didn't really know. So first question I want to ask you is the length, and these are probably really basic questions for you, but honestly, there's a lot of people that don't know. And it's some people just like, there's a lot of conflicting information. So intramuscular injection. Does it depend on the body fat level of the person? Can you use a 1.5 inch needle? Can you use an inch needle? Can you use a 3/4 inch needle? Because I know people are like, well, it depends. If you don't have any body fat and you're really, really lean, you can use a 1 inch. But if you have body fat, you should use a 1.5 inch, whatever. So what's your take on that, on intramuscular injections?
Yeah, I fall into that school of thought too, that like it depends on the leanness. That's one of the things like at Marek, we're dealing with not bodybuilders. Most guys really aren't that lean, like bodybuilder, obviously, as you can see, striations. For most people, especially around the glutes or something, you're going to have a significant amount of adipose tissue there. End skin, you got epidermis, dermis, you've got fat, all fascia, all before you hit the muscle. And so a lot of times if you're just using a small insulin needle, like a 1/2 inch, you're maybe just depositing it in the fat, which isn't necessarily a bad thing. But if you're trying to get intermuscular and you have a little bit extra body fat, you may need a longer needle. Okay. And so, I usually will recommend, because we do a lot of like L-carnitine injections, which is a full cc, and it kind of burns if it's sub-Q. Yeah. And I'll usually recommend doing a longer needle so that you can get it into the muscle belly where there's less nerve endings and it doesn't burn as bad.
So if guys are doing injections, well, let me get back to that. So intramuscular, and then you said something about now when it comes to fat content, do you do shoulders? And most guys don't have fat shoulders. So, well, I shouldn't say that. most guys who lift don't have fat shoulders.
Right.
So is it okay to do 1 inch, or can you use an insulin needle and do the 1/2 inch if you're not, there's not a lot of fat there?
Well, I mean, theoretically, you can get it anywhere because even these hormones can go sub-Q, and that's fine.
Okay.
So I don't mind if some of it's sub-Q. It kind of depends on the individual and their goals. But yeah, you could, like, a shoulder is a great place. Usually quads on guys are pretty lean too. A lot of guys don't put on a ton of fat on their quads.
A lot of guys, a lot of people say don't do. I always did quads, but a lot of people say don't do quads because there's a lot of nerve endings, blah blah blah. So
yeah, I don't like quads. I don't ever recommend them, mainly because it's like a virgin muscle. And for a guy, like, it's a lot easier to have a sore glute and walk around than it is a sore quad. You know, I remember one time in college, I tried to do one. I think I put, one of those crazy big shots into a quad. I was limping for like the entire week, like dragging my leg, and had to like lie to my girlfriend about how it was a workout that made me, just as my leg hurts because I didn't tell her that I was doing shit. And that was the most, and I've never really, anytime that I try again, like, it causes so much pain because I just don't do it all the time, Like having a sore delt, it's like whatever, a sore glute, whatever, but a sore quad just like, cripples you.
Yeah. So you're not saying there's any medical reason to not do the quads. You're saying it's more of a convenience.
Yeah, if you do it in the right area, which is usually a little bit more proximal or like up, more on the quad in a safer area, it can be safely done for sure.
Okay.
It's just, I think that it's, it messes people up pretty good if it's their first time ever doing it.
Yeah, convenience wise, it's not always the greatest thing. Okay, so you also mentioned sub-Q versus intramuscular. Now, there's a kind of a big debate about this. Some people say, oh, you can do all your shots sub-Q and it's actually better because there's a slower release and blah, 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 all this stuff. And I don't know, man. And then you hear other people say, look, if it's not deep enough into the muscle, it'll spill up outside the muscle, and then it sits between the skin and the fat in the muscle, and it's not where it's supposed to be. So can you kind of delve into this a little bit and tell me what's the benefits, if any, of sub-Q injections versus intramuscular? And if you're doing an intramuscular injection, does it go deep enough? If you've wasted your shot, like, maybe we touch on these things a bit.
Yeah, I think we had to kind of have to separate the goal and the person, because we have the TRT group, and that's one thing that's completely different than the bodybuilding group, right?
Yeah.
So when it comes to the bodybuilding group, depending, like, does it matter if it's intermuscular or sub-Q? I'd say the biggest determinant there is, like, are you causing issues that may be visible on stage? And so, like, getting something in the muscle, you have a much bigger reservoir, especially a huge bodybuilder's muscle. You have a big reservoir that can probably take the oil. Whereas we know if you're outside and it piles up on top of the muscle, you're going to have a visible lump, and that's what you don't want to do.
Yeah.
As far as like the absorption, I think that's kind of like moot point. I don't think it really matters, because after a while you hit a saturation point. So whether it took 5 days to get into your system or 3 days, eventually it gets into your system. You're doing it so frequently that you do hit that saturation point, and a few days difference of absorption probably isn't going to really matter. When it comes to the TRT group, that's a little different, because we're kind of trying to focus on things like sex hormone binding globulin, or SHBG. And there are some guys who will have good testosterone, but they have extremely high SHBGs for whatever reason, which is binding up all of their testosterone. And then we can change the route of administration. Like an intermuscular will have more of a suppressive effect on SHBG, and doing it less frequently will also have a suppressive effect on it.
Okay.
Vice versa, if a guy has a crushed SHBG and they're suffering from like low libido or something, we can do it sub-Q, and we can do it more frequently, and that will slowly increase the SHBG. So I would say, like, when it comes to a bodybuilder, probably the only thing that matters is the visibility. When it comes to a like TRT, there's probably more intricacies.
That's really interesting. So, okay, I didn't even think of that. So the only reason really it's intramuscular is for cosmetic reasons.
In my opinion, I think so. I mean, because like I said, after they're doing so much, the amount of like a bodybuilder's doing,
you're going to reach a ceiling.
Right. You're hitting that saturation point, and like, who really cares if it takes, you got a whole off season to be loading the shit up. Like, who cares if it's 5 days in or 10 days in? Like, eventually it's in, and you hit the saturation point and just keep going.
Okay.
So unless it really mattered to you, like, I need this in me like 3 days earlier, which, for a guy at bodybuilding, it doesn't matter.
But let me ask you this. So I've done an intramuscular injection in my shoulder, and I've had it like leak out, for lack of a better term, like come out, not outside the skin, but I could see it between, you know how there's that separation there between your tricep and your delt.
Yeah.
I could see it kind of floating between on that line, but it never went away.
Oh, interesting.
So I'm like, is it possible for it to come out of the intramuscular injection and sit there, or is it going to always absorb?
Well, it'll absorb eventually. Like you have esterases and things that'll come break it down that are, you know, you have
Okay.
these enzymes that will break it down.
Okay.
So eventually it will. It shouldn't just stay there unless your body mounts it off and forms scar tissue around it.
Okay. Okay. Um, so we talked about the cosmetic aspect being the main aspect. Now, you said more frequent injections and sub-Q injections can basically raise your libido.
No, well, not
If
necessarily.
if you have too much of the binding hormone. Or
Yeah, so if you have too low of SHBG,
okay.
SHBG is like a finicky thing. When guys have it way too low and you basically just have like free testosterone like crazy,
Yeah.
sometimes that can almost have a suppressive effect on libido. Like I think most bodybuilders have probably experienced a time when like the higher your drugs get, sometimes libido can fall off sometimes too.
Yeah.
You usually have that sweet spot where things are perfect, where you're getting good sleep and your appetite is good and your libido is good. And then when your drugs are maybe too low, you feel crappy in all those regards. And when your drugs are too high, you feel crappy in all those regards too.
Okay.
And so for some guys, if their SHBG is way too low, it can almost negatively impact their libido. Their sympathetic overdrive, that fight or flight, is just like crazy because they have so much hormone in circulation. And that's when we can try to increase SHBG by doing more frequent and like sub-Q injections.
Okay. Okay. So you want to, okay. So you want to
And then
increase, go ahead.
oh yeah, and I was also going to say, I think like as Marek and a lot of the providers these days really just like to do more frequent, anyways, to
Mm-hmm.
more mimic natural levels. Like I said, when it comes to bodybuilders, like the doses are probably so high that it really doesn't matter as much. So I still feel like there's probably utility to more frequent, just in keeping those levels as high as possible and as stable as possible. So instead of getting dips where you get like a spike on Monday and then it falls back down, then another spike on Thursday, we can do like a Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday injection and just keep it kind of stable, which I do feel like increases your ability to get more hypertrophy just because the ranges are always in optimal level. So I do think there is utility in even bodybuilder doing more frequent injections and keeping their levels as stable as possible.
If you're doing sub-Q injections, does it matter where sub-Q?
Not necessarily.
Like,
Um,
you do insulin, you usually like you can pinch your stomach and do it there or whatever. Like, can you do the same thing with test? Doesn't matter where.
Yeah, theoretically, again, it would just come down to like the cosmetic issue because when we're talking TRT, like a
Yeah,
weekly,
I mean for
yeah.
like normal people that aren't competing.
So like a bodybuilder doing a blast, even a weekly, is probably going to come out to like what at least a half or a full CC, probably, with all the compounds they're doing. And I can't imagine putting a full CC into an abdominal sub Q.
No,
Like,
no, no. I mean more for like. So I'll give you an example. Let's say just take me for example, just for lack of a better, just for an example.
yeah,
So let's say I'm doing 100 or 200 milligrams of test a week. So you're saying if I do like 50 milligrams a test 4 times a week, I can do it like anywhere sub Q.
oh yeah, because that's going to be such a small amount. You can totally
Yeah.
do it like in the abdomen, like around the belly button.
Just use an insulin needle and it's done.
Yeah,
Huh. See, that would save me a lot of trouble because right now, most people know that watch the podcast. I do like one shot a month, which is doing exactly the opposite of what you said I should be doing.
yeah, it's awful.
I'm getting like a spike of like 250 milligrams, and then I'm just like dropping all through the month.
Exactly. I think you'd be better off doing like 150 a week, like tops, and splitting that into a
No,
few, three.
no, but this is interesting because one of the things I hate intramuscular injections. I did them for so many years that I'm like, I just can't stand it. Right. So,
Yeah.
but now if you're telling me I can do just a small insulin needle sub Q and it's just 50 milligrams, I could probably make that. That's easy.
Yeah. It's a
It's
small
better.
amount of fluid, super
Yeah.
small. It's quick, easy.
Small needle, small fluid,
Yeah.
doesn't really feel like anything.
Right.
Okay. I can do that. So you're suggesting that's what I do moving forward.
I do think it'd be better. It'd probably be better on all systems too, because you're not getting that abundance of testosterone and then crashing your testosterone. You're just basically on like a hormonal roller coaster how you're doing it now.
So when people, okay, is it possible to feel good on nothing though? Like,
Oh yeah.
how can I explain it? So when we did my blood work, you said my test levels were a little low. But I feel great.
Yeah.
So
I mean,
how is that
I try to
possible?
preach this all day, every day. Like testosterone is not the end all be all. And I wish that we would get this out of people's heads. Like,
Yeah.
I really feel like I kind of hate how much like TRT and everything is advertised at this point.
Yeah.
Because you're totally right. I mean, you can feel great with lower levels of testosterone. I've literally had professional athletes come in who they're confiding in me. They would tell me if they do stuff and they have like a 300, 400 testosterone. These are like CrossFit competitors or like football players or something. And they're like, I don't do things I never have. And I'm like, your testosterone's not impressive, but there's so many other things that go into that equation. Some people are just genetically gifted. They don't need loads of gear. And so I'm always trying to talk guys out of TRT. Like if you can avoid having to inject yourself multiple times a week for the rest of your life, you should. Like if I could go back, given what I care about now in my life, I would have never done that stupid shit. And I would
Yeah.
probably be natural and be fine. Like at this point, I barely look like I lift and I don't care about it because I care more about business and family and everything else, And I'm just like, it never got me anywhere in life. I put myself at risk and now I'm stuck like having to remember to inject myself all the time. And it's a pain in the ass, as you know. And so, yeah, it's absolutely possible to feel good on lower levels of testosterone.
So not to get into you don't have to talk about your background if you don't want to, but so are you saying you suppressed your natural testosterone forever, pretty
Oh,
much?
probably so. Cause I mean,
Yeah.
like the first cycle I did, which was stupid, was
Did you
like
do that? Did you do that much gear?
I, probably so. I mean, I've never tried to get off because I just don't want to deal with that either, like being
Really?
people. So
You
the
were
first cycle I did was like 500 milligrams, like basically the bodybuilder forums would tell you do 500, which
yeah.
was way too high. It should have been like 200 for my first time.
Yeah,
And
exactly.
then after that, I came off with HCG, Nova, stuff like that, like the forums told me to. And then I did another one, which I think I added EQ in on that time. And then like after that, I did another one with D-ball. And after that, I was just like, that's when people started talking about blasting and cruising. And I was like,
No,
yeah, that's what
no.
I'm gonna do. And so I would basically just sometimes blast would probably be a year long, honestly, sometimes because I didn't know any better, I'm like we said, I wasn't getting those side effects. Like I didn't have acne, I still had all my hair, I kept cruising. So I'm sure like, it's been like a decade of having hormones in my body.
I thought I was bad.
Yeah, and see,
Even I knew. I think there's only honestly, there's probably only 1 or 2 years of my career where I went the whole year,
really?
and it wasn't a blast. It was like an up and down, right? But all the other years of my career, I would go off after like it would be 4 months max. It would be 3 to 4 month cycle, and I would go off for at least 8 weeks.
Yeah.
So
You probably like I've probably done crazier cycles than maybe even you, and I had nothing to show for it. And I'm not alone in this. Like,
no, I know.
there's so many guys at the gym who you would look at and be like, they look like they lift. That's it. They are not impressive whatsoever. And they're doing more than the pros are. And I know people think you guys are full of shit, but I mean, I'm like, I've lived that.
Yeah,
I've filled myself up with copious amounts of things and never looked like you guys
yeah,
because the biggest one, the genetics weren't there. And then
yeah,
after that, too, to be honest, I didn't eat as well as I should have, like you guys do. I've done like one cycle where I actually ate really well and
yeah,
actually trained really well. And I put on a shit ton of size with a low amount of gear. So
yeah,
I like try to impart on these kids coming in, like, Fouad, Ian, these guys don't look that way because of the gear. Look at the gear
yeah,
as a supplement. Like if you look at Ian, he's eating every 2 hours all day long, just like
yeah,
like try to do that for a year and see what happens, and then
yeah,
train the way these guys do. Like it's not the gear, and
yeah,
it's the genes too. And like it sucks because so many people like myself, they get into this, they start loading themselves up, they're doing their body serious harm, and they're never going to get anything out of it. I mean, I know you've got your health problems you've been public with at this point, but at least it built you a life.
yeah,
Like a lot of guys, like they'll do this, they'll have the same harm as you, but have never gotten anything out of it.
yeah.
What is like, probably a fraction of 1% of people who lift actually get to that level of like making money out of it these days.
Let
So
me
it's
ask
like,
let me ask you this question because this has come up in the past and it kind of bothers me. So there has been I've had a few friends pass away in bodybuilding, and every time I say, we do these talks and I try to regularly bring somebody on to impart some knowledge on blood work and mitigating risks. But inevitably, there's always a side to the conversation that says, look, bodybuilding's unhealthy, period. There's no mitigating risks. There's no being healthy. There's no living longer. You're fucked if you do it, and that's the end of it. Now, there's a part of me that kind of believes that. Like, I know if you're taking anabolics and you're getting to 300 pounds and you're stepping on the Olympia stage, you're probably taking some years off your life. So I'm not ignorant to it. But I guess my question to you is, can people lift and be a professional and mitigate risks and try and live a somewhat healthy lifestyle? Or is it inherently just not good for them to do what we do?
I would say it's inherently not good, but there are, like you said, like, it's true. It's just inherently bad. It's always going to be detrimental in some way. It's never going to be healthy.
Yes.
But you 100% can mitigate risk. Like, there's so many different tools that we have at our exposure. We've only talked about insulin, but there's blood pressure, there's oxidative stress, there's so many other things that are huge that can be implemented, that should be it's like, is smoking ever good for you? No, but like, if you just smoke in isolation and do so many other, like if your diet is good and your sleep and XYZ, like you're obviously at a little bit better overall than somebody who's smoking and just letting all the rest of their life go to hell too.
Yeah.
So it's not to say that smoking can ever be healthy, just like bodybuilding on gear and stuff can probably never actually be quote unquote healthy, but it can be healthier.
Yeah. And I think that's what I'm trying to do with my channel, is say, look, you can do this in a better way than I did, or you did. So no,
which
but
I did. He got nothing out of it.
Yeah, no, but I guess if you don't mind sticking around for a bit, I want to talk about blood pressure, because you brought that
Absolutely. Yeah.
So I've told the story many times. My kidney issues come from having high blood pressure and not having the right doctor to tell me when I was 30 that I could have taken a blood pressure medication and kept on bodybuilding. The question I want to ask you is, if somebody, let's say a 20-year-old, or is there an age that's too young to be on a blood pressure medication?
No.
No. So let's say a 20-year-old comes to you, 25-year-old comes to you, the kid weighs 250 pounds. I want to be a pro bodybuilder. You've already detected he has high blood pressure, maybe because of his weight, because of the anabolics, his hereditary issues, whatever it may be. Do you talk him out of doing what he's doing, or can he take a blood pressure medication and be relatively healthy? And how will that blood pressure medication affect his lifting, his pumps, his strength, all of the bodybuilding markers that he's looking for?
Yeah, for sure. So, I mean, first, I'd probably be like, be realistic about this. Are you ever going to make anything out of your life with this? Yeah. And if not, maybe question it. Somebody who does have a promising career in bodybuilding is going to start at 20. They're like a Nick Walker or something. Like, let's get you started on blood pressure medication from the get-go. Even on TRT, I think it's probably a good idea to add in some type of blood pressure modulating medication from the get-go, just due to the effects of elevated testosterone on, there's a system in the body called the RAS, renin-angiotensin-aldosterone system. And it's really the crux of like pretty much all ailments that affect bodybuilders: the heart remodeling, the growth of the heart, the left ventricular hypertrophy, the blood pressure, the kidney damage. It's all kind of mediated through that system that testosterone really kind of switches on. And so we can start something like an angiotensin receptor blocker, like a telmisartan, from the get-go. And I honestly feel like it should just be prophylactic. And it's crazy to me that people aren't okay with that, but they used to be fine with just throwing in an AI off the bat. Like, no one questioned an AI. But if you bring up a blood pressure medication, it's like, no, let's not do that.
But I think the reason, and I know that I've had that sentiment before I was educated on the topic.
Right.
I think it's because guys think, when you say take an AI, it's just part of a steroid cycle. It's going to make me look a certain way. It's whatever. It's going to keep me from having gyno, whatever the situation is. It's more of they're taking it because of cosmetic reasons. If you tell somebody to take a blood pressure medication, they think something's wrong with them.
Right.
So their immediate reaction is, no, there's nothing wrong with me.
So I try to place it in, like telmisartan, which I just brought up. I literally take that now, and I don't have any high blood pressure. I take it for the performance enhancing and longevity benefits that it has.
Can you explain what telmisartan is really? Because I don't, like, it's an ARB, but can you explain what that is? Yeah.
So it's an angiotensin 2 receptor blocker. That system I just brought up, renin-angiotensin-aldosterone system, is a system that is our body uses when our angiotensin aldosterone goes up. Our body holds on to more sodium, and that holds on to more water. So we have more water in circulation. It also vasoconstricts. And so, when you put your thumb over a hose, you get higher pressure. And so our system constricts, the opposite of a pump. It gets, small vessels, and we have more water. So our pressure goes way high up. So that system's there to regulate low blood pressure. But when we're using steroids, we just crank on that system and that cranks up our blood pressure. So this ARB, angiotensin 2 receptor blocker, it blocks that receptor so that the angiotensin can't convert into aldosterone and it can't have those vasoconstrictive and water retentive properties. And so one thing I was going to say is like, I do feel like it has performance enhancing benefits. It also impacts something called PPAR, PPAR gamma in specific, and that has insulin sensitizing properties. So you're kind of taking care of that insulin sensitivity. It also has endurance enhancing properties. So you're able to do more reps, and it has like fat burning properties. There's a common compound out there called cardarine or GW15. Are you familiar with cardarine? Do you remember that?
No, I don't.
It was one that people would often run alongside tren to kind of mitigate the cardio crushing effects of tren. So people
is that
endurance.
Is that a SARM?
It's called a SARM, and you could buy it on like SARM websites.
I know what you're talking about now. Yeah,
and it caused cancer.
I didn't know that.
Yeah,
I never took it, so I don't care.
Yeah, it was one that people would take like left and right and defend the hell out of it. Yeah. The effects of cardarine, the benefits of it were through that PPAR system. So people would take it to increase HDL cholesterol and increase their endurance while taking tren. But that was put into clinical trials and basically failed at every dose because it was causing cancer in rat models. And people are fine filling themselves up with that, but then they stay away from like telmisartan, which is like, this has those benefits too, and it will save your blood pressure, and it's made it through the same exact trials and been deemed as safe.
See, I didn't know. I'm really happy with the way you explained things. I take telmisartan, and I understand my blood pressure being lower, being a good thing. I did not understand the fact that it would give me better pumps in the gym, because obviously the vasoconstriction is doing the opposite.
True.
So yeah. I didn't understand, like, I think if you sold it to somebody as, look, it's healthier, but it's also perform. I've never heard.
I always try to tell people that.
Yeah, but I think more doctors could be doing that, because I've never heard any other doctor say to me, this is going to help your performance and keep you healthy at the same time.
There's another aspect of it that'll probably make bodybuilders flock to it, is it has been shown to be a myostatin inhibitor potentially.
Perfect.
And so, I mean, it's probably like not really like it was more in females at a small amount, but I won't get into that. We'll just tell people it's a myostatin inhibitor and it'll fly off the shelves.
Now I know I am still 260.
Exactly.
Okay. Before I get off blood pressure, I want to ask, it can't all be positive, or can it? Is there any negative effects to taking telmisartan long-term, or taking it with gear, or taking it when you're young, or any of that? Is there anything anybody should look out for?
In my opinion, probably not. I mean, of course, everybody's the individual. Like your buddy Ben, I think, had a real bad reaction to telmisartan, right? Like, didn't it fuck up his show because he had diarrhea or something?
I think he realized that taking an A1C, which is another form of blood pressure for those people, blood pressure medication for those who don't know, an A1C helped him more so. Or sorry, not an A1C. I apologize. We're talking about diabetes earlier. An ACE inhibitor worked for him better than the ARB, which is telmisartan. Right. Yeah.
Which is basically working the same thing. It just works a step later before. Yeah. So it's in the same cascade. But I remember he had a bad reaction to telmisartan. So everybody is an individual, and you may have your own weird things that, you have an issue with. But for the most part, I mean, you're already committing to filling your body up with these crazy chemicals anyways. Like, why not one that actually has some health benefits associated with it? So at the end of the day, is being 100% natural and never touching a medication better? Maybe. I've kind of now switched over to like the whole transhumanism idea, though, is like, I don't yell across the United States to talk to somebody. I use a phone. And so I don't have an issue with benefiting my body with technology through medication, either. For some reason, we have this like real naturalism belief of like everything natural is better. And that's where people like the carnivores are selling all their shit, because they kind of, they promote that natural type of thing. But in my opinion, if you're already down this road of enhancing yourself, enhance yourself with some health aspects too.
I think it's a trust thing, though, is I think more so what it is, right? I think people have trouble trusting pharma industry, they have trouble trusting
The
their
pharma
doc.
industry who made the hormones that they're injecting, that's
I know. Listen, I
it's
know.
fun. I know I deal with this every day because we got guys who are like,
Yeah,
oh, I don't want to take that. I'm like, okay, let's just get rid of your testosterone then too, because the pharmacy's making that.
made
No, no,
this
no, no,
the
no, no.
same company made that.
Yeah, exactly. No, 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 don't get rid of the testosterone. I'm like, you realize it's pharmaceutical.
No, I know. I
No,
listen.
I get it.
I get it, but I think I'm just trying to. We're having a little back and forth about what it is, and
Yeah.
I think it could be a trust factor. Is number one. One, I think it's a trust thing. It's like, well, you're telling me to take something, I got to take it for the rest of my life. I don't know. Is that really good? Is it gonna come out in 10 years that it was bad and I've been taking it this whole time? Because that has happened too, right? So
Yeah.
there's that aspect, and then there's the I don't want to believe that there's anything wrong with me, and if I'm taking this, that means my body is not good enough to do what it's supposed to do on its own. So you're telling me to take this thing to help my body, and my body should be able to just do it. It's kind of like,
Right. But then your body should be able to grow to the size that it is naturally too without injecting shit. Right. So like there is something wrong with you. You're not good enough on your own to get on the Olympia stage. You suck. You know?
That's a good point. That's a good point. No, listen, everything you're saying makes sense, but I'm just saying, like, that's the look.
Yeah, I know.
That's how I thought it. Look, I'm not speaking from a position of authority. This is what I thought.
I know.
When I
No,
when
it's
I
funny too. We
when
also
I
get like people who, for cholesterol, they'll be like, I don't want to take a cholesterol medication. I don't want to take a statin, but I'll take red yeast rice. I'm like, you realize we make statins out of red yeast rice, right? Like you're just taking one that is like actually regulated and has like evidence behind it instead of just being sold by a sketchy supplement company. But people just would rather do more natural things and stay away from the farm companies.
but I also wonder, like, when it comes to things like statins, there's a lot of I don't know if they're myths, but there's some conversation circulating around statins that it's not good for your training.
Yeah.
You might have sore joints, you might have this, you might have that. So I don't know about the normal world, but in the bodybuilding world, I feel like that's why guys are like reluctant to take statins, right?
Yeah. I get that.
If it affects my training, I'd rather. It's like the guy who's eating and wants to get his foot cut off.
Yeah.
Bodybuilders the same way, and I was the same way. It's like, you know what? I don't care if I want to keep going. I don't care.
Right. Yeah, and I'm like super like bullish on trying to correct cardiovascular health. That's the thing that like I care about a lot now. Blood pressure, at least we're finally all talking about, and we know. I think it's pretty like standard for guys to take telmisartan. There's been some integral players in the social media, John Jewett, et cetera, who have kind of popularized it, and that's awesome. Yeah. Not enough people talk about cholesterol. Even John posted something yesterday, which I like completely disagreed on, where he was saying like, if you go get a calcium score and it's okay, you probably don't need to add a statin in yet. And I was like, whoa, that doesn't make sense to me. Would you say it's cool to keep smoking as long as you don't have like, you get a chest x-ray, there's no tumors, you can keep smoking, wait to do something about it until you get the tumors? Like, no, but that's the way we're looking at cholesterol and cardiovascular disease.
Explain to me, before we go, let's touch on this last thing, because this is really important. So bodybuilders notoriously have low HDL from taking anti-estrogens or whatever. Their HDL mine's always been low. You hear some people, cholesterol is not bad. Cholesterol is fine. You need cholesterol. That's what you hear from a lot of people, right? And I know there's different particles of cholesterol. There's like large particle and small particle, and one's dangerous, one's not. Or I don't know if that's true or not, but you can explain that. But what is it? Because this is something that I think people are just confused about at this point. Because some people are like, you need cholesterol. Some people are like, cholesterol is horrible. Take a statin. Where am I? Right. What do I do?
It's highly confusing. If anybody's talking in absolutes like that, you should probably just keep swiping, because they probably don't understand basic lipidology. And when somebody says good cholesterol, bad cholesterol, I'm like done. Like, I'm not listening to you because you don't know what you're talking about.
Okay.
So cholesterol is 100% essential for our life. Without cholesterol, we wouldn't live. It makes up every cell in our body. There's a let's see, how do I explain this? So the one that we measure, like LDL cholesterol, HDL cholesterol, we're measuring cholesterol within the plasma, within the blood. Yeah. So cholesterol is making up our brain, it's making up our cells, but there's also this extra cholesterol found in lipoproteins. So we have lipoproteins like HDL, LDL. So high density, meaning they're very heavy, and then low density, meaning they're very light, low density lipoproteins, and very low density lipoproteins. And essentially what those are they're a mixture of things of cholesterol, triglycerides, phospholipids, and they also have this protein coating on them. Because if you think of cholesterol as like a fat, if you put fat into liquid, it floats. You can't really transport it. But you mix in a protein shake, it mixes in and becomes one with the water.
Okay.
And so our cholesterol gets wrapped in this protein so that it can make its way through circulation and be delivered to target tissues. And that's where the lipoprotein comes out. Now, there's something inherent to LDL cholesterol. It's called apolipoprotein B. That's the protein that wraps around that cholesterol and transports it. And that's what gets stuck to the arterial wall when there's damage to that wall and allows in that cholesterol, which then mounts a response for your body to come try to get it out, which forms plaque, blah, blah, blah. And so really focusing on the LDL cholesterol and the apolipoprotein B component of that and keeping that lower, we know through Mendelian randomization and through clinical trials, we know that it's a causative agent of cardiovascular disease. Okay. And so we should absolutely try to keep LDL cholesterol and apolipoprotein B lower. The confusing part comes with HDL cholesterol because we've done studies that have increased HDL cholesterol and it didn't change outcomes whatsoever. So people still had the same amount of heart attacks and strokes. And for years, we've been told HDL cholesterol is the quote unquote good cholesterol.
Yeah.
Because it should be able to transport the bad cholesterol back to the liver. And so people call it like an HDL transporter.
Sure.
But that just hasn't played out in clinical data. And so that's where it definitely gets confusing. Like, should we even care about HDL? I don't think even like prominent lipidologists now say we don't really know about HDL or what its real role is. Sure. Super complex. And so I would say for optimal cardiovascular health, try to keep your LDL cholesterol and your ApoB down as low as you possibly can, especially when you're using like hormones. I mean, one of the arguments is we need cholesterol to make hormones. Like, you're injecting your hormones. You don't need to make your hormones anymore. Like your testosterone's taken care of. So don't worry about that. Yeah. I would honestly probably aim to keep LDL cholesterol like 70 and below, because that's where we know the lowest risk is. And then I would try to keep inflammation low, try to keep blood pressure low, don't smoke, all the things that you can try to do to mitigate cardiovascular risk, because in the natural population, atherosclerosis is the leading killer. Like most of us are going to die from a heart attack or a stroke. You add steroids, heavy lifting, excess weight, blood pressure, all of that to the mix, like that's a recipe for disaster.
Jeez. Thanks for killing my buzz. Fucking terrified now. I don't want to go to the gym. Now I don't want to go to the gym and lift. I'm scared.
No,
okay, so I got to keep my LDL low, but you said there was a second part to LDL. What was that?
Apolipoprotein B or ApoB.
Okay, so ApoB. Is that, can you explain to me what it is when they say LDL has two parts, a small particle and large particle? What does that mean? Is that even a thing?
Yeah, so there's, like I said, there's varying degrees of these lipoproteins, and it all depends on their density. So you have very low density, like VLDL cholesterol, okay, or you have just low density LDL cholesterol.
Okay.
And so the smaller the cholesterol, the less it weighs, theoretically, the more dangerous it is, because it can get into little defects in the artery and things like that. Kind of is, for lack of better terms, layman's terms, just say it's more sticky or whatever. It can get stuck in the artery more than the bigger ones can.
Okay, so ApoB, when you go for regular blood work, because like when I go to my regular doctor and I get like a family doctor or clinic and I get my blood work done, all I see is HDL, LDL, and then a ratio.
Right.
I don't recall seeing ApoB. So is that something that they're not normally testing for, and that's something specific you have to ask for?
Yeah, they're not normally these days. If you do have a clinician who orders that I'd be highly impressed, because those people are probably current on the literature and know lipids very well. If people are telling you like it only matters about your HDL to triglyceride ratio and stuff, like they are so outdated, you need to get info from somebody else, because we know that that's not true. Okay. But really following things like your ApoB is super important. There's also another one, and I know like this gets super deep and way further in this conversation, but there's another one called lipoprotein little a. It's an A in parentheses. So lipoprotein little a. That one is a genetic lipoprotein that you either have the gene that codes for that protein or not, but it's highly atherogenic, meaning it forms a lot of plaque. Okay. And so I would almost like recommend that, guys, if you're thinking about going down this like lifestyle, like look at your stuff, and if you have high ApoB, maybe reconsider getting deep into this game, because it may be very detrimental for you. Because there's not a lot that we can do from pharmacology to reverse that lipoprotein or that LPA little a. So you're going to be at high risk just out the gate.
So that's hereditary. Like you're kind of
It
like,
is.
okay. And you can
Yeah.
test for, and you can test for that.
Yeah, it comes like on a Merrick panel. You'll get it, I
Did we
think,
t- did
almost.
we
Yeah. We
we
tested.
tested
I can't remember if you have it or not.
just say
Um,
just say mine was really low just for the
yeah, super low. Your cholesterol is great. But there
um
are things like, the PCSK9 inhibitors, like I think
we
we
talked about that,
recommended
yeah.
for you. Yeah, that can help to lower the LPA. We still
So
don't know if that lowering has any clinical significance or not. There's
just
also
before
another medication in the works that can lower it.
just before we go carry on, I don't want to just blurt through things and then have people not understand what we're talking about. I'm trying to make I try and keep things in layman's terms because this is the bro podcast. So
Right.
um PSK9.
PCSK9
PCSK9. That's the one you recommend that I get for my heart.
for your cardiovascular health in general. Yeah, to try to reduce the cholesterol because you do have very high cholesterol. And we also were kind of contemplating whether or not to use a statin with somebody who has difficult, issues with their kidneys.
Yeah.
So there's one like a atorvastatin, which I think your doc already had you on, maybe, or
Yeah.
talked to you. Yeah.
Yeah.
So that can help to lower it without affecting the kidneys. But in somebody who has very elevated cholesterol, there is a new agent. They're monoclonal antibodies, and they inhibit something called PCSK9. How do I explain what that does? So our liver has receptors on it for LDL cholesterol, and those receptors grab the cholesterol and then use up that cholesterol, so it's no longer in
Okay.
circulation.
Okay.
PCSK9 makes it um, so that those receptors get kind of used up as well and damaged. And so when you inhibit that enzyme, we leave those receptors so they can grab onto more
More.
cholesterol.
Okay. I get
Yeah.
it. I get it.
So I'm
So
glad I was able to explain that.
so for the average person when they look, their main goal, like instead of diving so deep into partitioning all the LDL stuff, their main goal, if I say they should just try and reduce their LDL period, is that a safe thing to say?
I think, yeah, I mean, it's obviously a huge generalization. And of course,
Yeah.
there's minutia, and,
Yes.
lipidologists will debate this. But I would say, from your random bro ordering their own labs on Merrick, not wanting to meet with us, like
Yeah.
focus on getting that LDL-C and the ApoB pretty low. So, like I said, at least below 100 for the LDL-C.
Yeah.
Ideally, keep it like 70 and you're golden.
So without taking any medications, without taking a statin or anything like that, is there any other ways other than diet to lower your cholesterol?
Diet's huge. So when it comes to diet, I mean, for the most part, bodybuilders are eating pretty heart healthy diets, anyways. Most of the time, it's pretty low saturated fat, pretty high amount of fiber. I mean, depending, but we're usually getting some amount of fiber. Like the diets that wreak havoc, or like the new carnivore diet, guys come in and I'm like, holy shit, like you're about to have a heart attack. Like this is so bad.
But that's promoted so well. It's like, you see like Jordan Peterson, one of the most popular advocates of it, talks about, oh, I'm so healthy, my body's so great after being on carnivore diet for so many months or years. What
Right.
Why is it not work? Why is he saying it's so great, and why do you think it's so bad? Just because the cholesterol itself?
Yeah, the cholesterol itself, I think that it does have great benefits. So those are usually improved insulin sensitivity and usually significantly decreased inflammation. Like almost nobody is allergic to meat. There's one super rare disease and people probably die early on if they are allergic to meat. So most people are able to get significantly improved insulin sensitivity and significantly lower inflammation, which is great. That's awesome. And so they usually get less, rashes if they're like, have autoimmune
Yeah.
psoriasis or Crohn's. Like those usually kind of resolve because they're not inflamed or in any way. But I do think they're doing a huge disservice to their cardiovascular system. The argument that people will make is that, well, atherosclerosis, the buildup of plaque, is a host of different things, and it involves insulin resistance
Yeah.
and inflammation, etc. But we have really well documented studies that show that cholesterol in isolation, with all other factors kind of accounted for, still is atherogenic by itself.
Okay.
And to also go through life like hoping that you never get inflamed, that's just like not a risk I would want to take.
Yeah.
I mean, to me, it's like, let's get rid of every risk factor, especially the huge one that's the common denominator. Like, I mean, I wouldn't tell somebody like it's cool if you smoke as long as you work out and do like all your other risk factors are done. Like, it's never cool to smoke. It's never cool to have elevated LDL-C. It's just not going to turn out good for you.
Yeah. Yeah. I wonder if it's because it feels so good in other ways.
Yeah.
Number one is the ease of the diet. I don't have to think anymore. I just eat meat. That's it, right?
Right.
Number two, less inflammation does feel good, right? When you're like, you don't get that swollen feeling in your body. Like, number three, your stomach's probably flatter and you're probably losing weight because you can't eat as much food. You're not going to eat
Right.
6,000 calories in steak. I mean, you
Yeah.
might.
Most people are reducing significant amount of calories.
Yeah, so you probably feel better just because you're eating less and you're more satiated because protein's so heavy, and you're
Right.
getting some fats in the. So I think it's hard to explain to people why it's bad for them when all these other things feel good.
Right. It boils down
Right.
to that thing though, again, like some things that are bad for you feel good. It's just the way that it is, you know?
Yeah.
But I think what's crazy to me is like, just like the steroid argument, like I am all for carnivore. I would be like, just take a cholesterol lowering medication too. And then like, you know, you can have your steak and eat it too. Like total dad joke.
Yeah.
You
Yeah.
know, like
Yeah.
you could literally do carnivore and lower your cholesterol and probably have an amazing health. Like, you know, you would have low inflammation, insulin sensitive, your cholesterol would be low because you're on the medication. But those people who the carnivore diet kind of attracts, they are very much so of the like the
The
natural.
natural. Yeah.
Yeah. You
I wonder if Jordan Peterson takes a statin. That would be interesting to ask somebody like him, because I feel like he would be somebody who would listen to that and be like, okay, I can do that.
there are some people too that like we see carnivores come in have a little bit more sensibility, and they do like obviously bodybuilders eat a shit ton of meat, but they eat low fat meat. So
Yes.
you can fill in poultry, you can eat fish, like you could eat carnivore and not have to be eating like fat marbled steaks all day long.
I was actually going to ask you that. So if let's say you did, I know it's not carnivore anymore, but let's say it's actually probably just keto that I'm talking about. I was going to say, what if you did carnivore, but you added in fat from like avocado or olive oil or like
Yeah.
healthier sources? Then you're better on the cholesterol front and you're still getting the carnivore
Yeah, you're
aspect.
probably like
But now you,
amazing at that
but now
point.
you're just keto at that point, right?
Yeah, but I mean, these carnivores these days aren't like carnivore now. They're adding fruit in and honey. Like that's a new thing. They put honey on
That's not
everything.
carnivore.
I know, but their
So
biggest proponent is puts honey and fruit on everything.
so they're cheating basically. They're like,
And maple syrup, that's another one for those Canadians. Like they're putting maple syrup all over their liver.
what the? How's that fucking? Now you've just gone back to the inflammation. Now you're adding simple sugars and
Supposedly, it's not going to be inflammatory. They say for
why?
whatever. I don't know because our ancestors did it. Who the hell knows? It's always like whatever our ancestors did. I'm like, dude, they probably died at like 30. You got to cut and like you die. Like I don't know. I don't want to fuck my ancestors. Nature's a bitch, you know. Like nature will try to kill you. I don't want to live off of like as natural as I can be.
People are fun. People are funny, and I'm one of them. People have funny little quirks about things. The statin one was a big one for me. For the longest time,
Yeah.
I was like, but for me, like I said, it was always the messaging around it that I had always heard is it's going to affect your training.
Which it can do, but I think
Yeah.
there's safer ways to do it. And that's like, again, there's been some integral players. I think like Leo and longevity, the guy who just passed away. I know you guys had a beef or something for a lot. He was kind of a very
He's a,
toxic guy.
I'm not going to get into it, but go on.
Yeah,
Yeah,
right. But
yeah,
like he brought to the forefront some lipid lowering agents like ezetimibe. Ezetimibe is not a statin and it doesn't have those negative impacts.
yeah,
You know, and so there have been these players too, and I hope people are listening because there's ways to lower cholesterol without loading yourself up on a super high dose statin, and you can be safer.
yeah,
You know, I don't want to like say, you know, this is non-medical advice, but I do think most people from the outset of their protocol should probably do like an ARB of some sort and probably at least like an ezetimibe to kind of lower that the LDL, and then some anti-inflammatory agents too, just like high antioxidants, which bodybuilders are usually pretty good on. You guys get a lot of fruits and vegetables, or at least
yeah,
vegetables,
yeah.
but maybe even supplemented with like N-acetylcysteine and glutathione, things like that too, to reduce as much inflammation as possible.
I was just thinking about a friend I have who won't take Advil because he said it's, hard on the body, which is not necessarily untrue,
Right.
but he smokes like half a pack of cigarettes a day. So,
That's pretty comical. Yeah.
so it always makes me. It just came to me when we were talking about this. I'm like, that motherfucker is just like what he's talking about.
Exactly. All
Yeah.
the quirks that we have, like,
Yeah.
and it's most people are that way. And that's what I'm just like, you do realize where like the pharmaceutical companies made Anavar, Primo, testosterone, not people use equipoise, which has never even been used in humans. Like we don't even have any human data on equipoise. That's a horse drug. People will use that, no problem, but they won't, take an Advil or a statin.
When I used to do the cooking videos on my channel, I would always spray Pam
Oh yeah.
in the frying pan, or I would use sweetener like in my oatmeal or something like that. And inevitably there would be people like, "Oh, you're using Pam. Pam's bad for you." Or
Oh
and
yeah.
I'm taking 2 grams of fucking drugs, man. I'm like, I don't think the Pam is the thing that's
Exactly.
gonna is the thing that's gonna
And
hurt me.
I went on Mark Bell's podcast, and like anytime a clip or anything surfaces from that, I had a monster because they gave me a monster before we
Oh
started
no,
drink.
yeah,
There's
yeah,
inevitably like 10 comments like, fuck this guy, I'd never listen to him. He's drinking a monster. Like, this is a doctor who drinks the monster. I'm like, oh my God. Like, it's just people are crazy.
I know a few other doctors, and doctors are not as healthy as people think they are.
Oh, this is definitely true.
There's a lot of practices where you preach something, but you're not necessarily doing it yourself. So
Absolutely.
I'm not shocked. Like when I see a doctor smoking, I'm not shocked. I'm like, yeah,
At
that's fine.
this point in my life, I do try to practice everything that I preach. Like I swear, I
Yeah,
promise I'm not
yeah,
other, but I don't have any issue with freaking artificial sweeteners and caffeine. Like
yeah, yeah, yeah,
I'm gonna have pre-workout. I don't think it's gonna lower my life expectancy for any bit. I
yeah,
think
yeah,
we're
yeah. Well,
yeah.
listen, Adam, I appreciate you coming on, man. There's a lot of good information in this. And full disclosure, I am sponsored by Marek, and you do work for Marek. This is not an infomercial for Marek. It really isn't. As you guys can see, Adam had a ton of good information for us. But I do want to stress that going from my family doctor to Marek, I saw a dramatic difference in the blood markers. That I don't want to say difference. I want to say it was much more comprehensive what was expressed to me about my blood work and the markers they checked, and some of the ways to help me fix my situation. It was all thoroughly explained to me. So guys, I'm literally saying this to you because I think it's beneficial to any of you out there who are starting out, intermediate, advanced. Get your blood work checked. Like Adam was saying, if you're starting out, like you said, if you're starting out, an ARB might be something you want to consider if you're starting on a protocol,
Mm-hmm.
or
Yeah,
not
I think
not a statin, but what's the other one? Emetamine?
Ezetimibe or
Exenamide.
Zetia is the brand name. And
Yeah,
yeah, I think that's kind of where we differ too, is like, I mean, Derek's co-owner of the company. Like this is
yeah,
me, and the other owner, Mike, has done the exact same kind of self-experimentation and bodybuilding and everything too. So this is a company that was founded by bros who
yeah,
understand the needs.
yeah.
And like very smart bros. Derek has revolutionized the thought of performance enhancing. Like
Hmm.
he got rid of the only side effects being hair loss, and he
Yeah,
made
yeah, yeah,
took a
yeah,
deep dive into that and put it on the forefront.
yeah,
And so this is like-minded people like yourselves who do want to performance enhance but want to do it safer. And
yeah,
so and the just like a little overview of what Marek is. Like I'm not actually an employee of Marek, like I'm my own individual, and each doctor and health coach and things there are too. And Marek will facilitate putting you together. So if you come in as a bodybuilder, Marek has their coaches that'll kind of walk you through, and then they'll find a doctor that's in your state that can prescribe in your state
yeah,
that has like-minded goals like you. So we have females who are performance competitors, and if you're a female coming in, they might link you up with them.
hmm,
If you're a power lifter, they might link you up with one of the powerlifting docs, something like that. So
yeah,
it's kind of cool. They'll just help you to facilitate it. And if you don't want to deal with somebody, because a lot of bodybuilders are just want to do things on their own, you can just use it as a place to buy labs.
yeah.
For
I
years, I always use like private MD labs, and it's basically the same thing.
listen. I don't suggest that. I'm not saying you shouldn't, because it's better to do that than nothing. But
Right.
from my own experience, I would honestly suggest talking to somebody there, because, like I said, of how comprehensive it is and the information you get back when you do your labs. That's really the value. I mean, there's a lot of places you can go get blood work done. The value is having people really explain it to you, and people that have done it, been there, and
I agree.
understand it. And then the other factor that really, really mattered to me was uh, the fact that you guys have been there, done it. I don't get judged. You know what I mean? Like when me and you are talking about what I've done or where my health is now, I don't feel like I'm being judged or feel bad about telling you anything, because you've been there. So,
Exactly.
so that's a very large factor too, because a lot of guys are scared to tell their doctors, or the doctors are assholes. They don't want to help them, or they're scared they're going to go in there and get the steroid lecture or whatever. I think the ease of just being able to talk to somebody about what you need and not having them lecture you back is a really big
Yeah.
portion.
And I
But
mean,
anyway,
I was just going to put one more plug
no,
out there
go ahead.
for it,
No,
I
go
guess.
ahead. No, go ahead.
I was going to say, like I mentioned earlier, like we're not going to be the company. Like some people do feel like this is just a TRT mill. Let me go there and get my cycle set up, because
Yeah.
there are clinics out there that are doing that now. And from the outset, we've always said we are not a TRT clinic. We're not a TRT mill. We're a health optimization platform. And so if you think that you can come and just get legal gear, like that's not the case. But if you come and you tell me like, hey, I want to do this cycle, can you help me to be safer? Like I said, I can't prescribe you trend, but at least I know what it is. And at least I know how to do it safer. And we can talk you through the process. And we have health coaches, we have doctors, we have everything in between that can kind of help to be like, we know you're going to do things that aren't necessarily good, but instead of your doctor who would just tell you absolutely no, and I'm not going to help you, we'll help you to facilitate. We'll be able to prescribe the ancillaries. And getting the gear isn't hard to do. We all know that. And but getting the good advice and actually getting the quality, medication, that is harder to do.
Yeah.
So I think
I agree.
that Marek is a great outlet for that.
Yeah, no, I agree. Well, Adam, I appreciate your time, man. Maybe we'll have you back on next time I have a lot of pressing medical questions.
Let's do it.
But thank you very much for the time, man. I appreciate it. Is there anything you want to promote or plug or thank or anybody before we go?
No, I mean,
Well, we already plugged Marek.
Yeah, thank you. And I thank Marek. I guess people can follow me. I'm what's my Instagram? Doctor.
You know what?
AE Hotchkiss.
Let me show it real quick before we go, just so people know they can. This is.
Yeah, get me lots of followers for that.
This is this is Adam's Instagram. Got a lot of AI going on.
Oh yeah, I did go through that. That was cool, man. I looked fucking badass.
I know, right? If we only looked like
jacked.
If we only looked like our AI versions, it would be great.
And then I also have my company up there, which is Atlas. Yeah, that one is more of like mine and my wife's, where she does like nutrition coaching. So yeah.
Okay. Awesome.
Cool, man.
Okay, man. Well, Adam, I appreciate it, brother. We'll have you back on hopefully, and thank you so much for the time, man.
Of course, it was a lot of fun, man.
Okay, brother.
See ya.
Bye-bye.